Mental Health America of Louisiana, what we do is we provide transitional housing, and we also provide advocacy on an individual basis as well as a community. And we train individuals on how to advocate for themselves and how to advocate for their communities. We are having a wonderful time here today. Today is Behavioral Health Day with our theme, a behavioral health perspective, changing the dialogue. Yeah.
And tell us, what are some of the issues facing mental health in Louisiana?
Well, right now, the biggest issues right now is budget cuts. That's our biggest thing that we're looking at. Budget cuts specifically for behavioral health supportive services. And those are the kinds of things that we want to rally. We're here today to inform our legislators of how important these supportive services are. There are people here who are recipients of these behavioral health services. And for example, you may have a mother here that's getting supportive services because she may have lost a child to suicide. You may have a child here whose parents are in recovery from substance abuse. All of these are connected under supportive services. So without these supportive services, what we fear is that a lot of people may not have the opportunity to be medication compliant or to be able to continue to keep their appointments on time or to even be able to meet with their social workers.
Sometimes people, especially young people, struggling with mental health concerns, develop habits and behaviors that increase the risk of developing or exacerbating mental illnesses, or that could be signs of mental health problems themselves. Activities like compulsive sex, recreational drug use, obsessive internet, excessive spending, or disordered exercise patterns can all be behaviors that can disrupt someone's mental health and potentially lead them down a path toward crisis. So it's important to understand early symptoms of mental illness and know when certain behaviors are potentially signs of something more. We need to speak up early and educate people about risky behavior and its connection to mental illness.
I'm going to tell you a story about an 8-year-old girl. About 3 years ago, she was in the school system. Her parents found out one day she was going into first grade, sitting there reading her story one night. She couldn't read. They thought she could read. She got great grades in school. The parents went to the teachers and asked questions. Well, she's getting great grades. What do you mean she got a 50 on a test? Oh, we don't give failing grades. We need to pass this child. I was sort of horrified when I heard this story. Those parents went to seek more, to seek more services for their child who they believed had dyslexia, and were told it was a year to get tested. A year in a child's life at a critical time in development, especially for reading, which builds the foundation for the rest of our education. Are you guys mad yet? You should be. This is happening across this country every single day in every child's life that is affected by dyslexia and other types of behavioral disorders and learning differences. So this child's parents, lucky enough, they had the means. They spent $2,000 to get their child tested independently. Right? $2,000. It was a lot of money for this family at the time. They then went on, had the results, clearly showed that this child has dyslexia as well as some other learning differences. What do you think happened next? Well, what happened to this family next was just shocking. They went and took the results to the school and thought they were doing a favor to the system so the system wouldn't have to shell out the money for this testing. They were told the results needed to be done by the school and to be tested by the school. So even an independent source could not provide the validation for this family and help this child at the end of the day. Well, I can tell you what, that was my daughter. Right? I'm the dean of a school of social work, the Tulane School of Social Work. At the time, I was an associate dean at the University of Houston. I got the school board members together in a meeting, and before I said a word, I said, I got to say two things. I said, you all should be embarrassed. I said, because I'm embarrassed for you. How do you sleep at night? My wife's a scientist. I'm a behavioral scientist. I've been a social worker for over 20 years. My mom's a social worker. I know how to advocate. And when I cannot advocate, or my wife, for my daughter, what is happening to the single parent or the person that's not a social worker? Where are their kids left? And I said that to that meeting. It got dead silent. They didn't know what to say. And then I went on to tell them I'm pulling my kid from that school. I said she's not going to lose another year of her education. And I can tell you this year she graduated 5th grade with all A's. But the sad part about that is we had the means. Make no other choices about it. My wife and I had the means. Every single day, she also has autism. She's on the spectrum. I wear a puzzle piece on my lapel. I wear this bracelet for awareness, for for no more stigma. I go out in public with my child and people look when she's misbehaving. They say, why don't you spank your child? Really? That's like telling someone with diabetes, oh, just get better on your own with no help. Mental health and mental illness is real. I'm here for my daughter Feng Hua, and I'm here for each and every one of you and people across this country. There's a woman back here that has a sign, a pink sign that said mental health is real. Don't forget about us. Absolutely right. Don't forget about us. And I'm going to say it again. As a dean of a university, my child's medication, we just found out, was increased by 50%. Right? And she needs this medication. We're not talking something, ever changing here, an expensive drug. It's not a brand name drug. 50%. How is the parent that isn't in my situation, or my wife's or my daughter, able to help their children, or able to help the adults when they're cutting services and cutting costs? It's sad. I'm saddened every day, but I will fight every day for you and for my daughter and for the rest of the people out there that need us. So we need to end stigma, right? Raise awareness and get out there and do work that matters. Take care. Thank you.
Now, I can say this as a testimony, being a veteran of the United States Army for over 8 years. I myself have suffered with mental health disorders. I have had my daughter kidnapped from me when she was 3 months old, and today she's 37 years old. I have had problems with all kind of issues, trying to get my medication, trying to get people to understand that I am suffering with a mental health disorder. It is hard to be able to let people know what you are going through unless you advocate for yourself, unless you get support, have a support system. You must understand that you are not alone in this world. From being able to say that I needed my medication to be able to overcome, I myself felt bad, but I had to advocate for myself. And thanks be in the glory to God that my voice was heard. After so many years, it had taken me over 15 years, and I am 60 today. But I thank God that He gave me the strength and the knowledge and the understanding that I am not alone in this journey. And I want you to understand that you are not alone. Knock on doors, talk to people. Let them know that this is real. This is real. This is not a joke. This is nothing to be played with. We have too many kids suffering today and grown people suffering today. And we need to let our voices be heard. And if you can't let one person know, go to the next. If you have a support system of 5 people, that is fine. And if you don't have that, go on down the line. Go down to 4, go down to 3. But let your voices be heard. Make sure you get your medication. Make sure you have somebody that understands This cause is not just a cause for the low. This cause is for everybody. Everybody. So nobody is better than the next person. We need to have our voices heard, and today I am thankful that you guys all came out to let your voices be heard. Thank you.
I'm just going to say a few quick facts about teenage mental health. First thing I'm going to say is, here's something I hear a lot from just around. Whenever someone comes out to you saying, look, I'm just been feeling very down today. I'm feeling very depressed. The first things first, you don't want to respond with, yeah, I've been sad too. That is, I feel, is the worst, most heart-ripping emotion. Like, it's a feeling that you can't really explain. Cause it's like I'm coming out to you and you're sweeping it under the carpet. So that's one thing. Just a few facts around are 20% of youth ages 13 to 18 live with a mental health condition. That means 20% of everyone that you see around here could be living with a mental health condition. Suicide is the third leading cause of death in youth ages 10 to 24. And 90% of those who died by suicide had one or more mental illnesses that have not been treated. And I kind of put in, with all the budget cuts going around, it's like no one is getting the help they need. There are many kids my age and many kids that are older than me and younger than me that have issues, and they're not getting treated because there's no one there to help them, to hold them, to pull them in, to say, look, fam, I got you. So a few signs and symptoms of maybe depression or a mental illness is severe mood swings. 1 second they're happy, another second they're sad, another second you don't know. Drastic changes in behavior or personality. Extreme difficulty in concentrating. This can affect their schoolwork, their relationships, and everything that they do that they just have to keep their mind on, but they can't. Intense worries or fears that get in the way of daily activities. They can be outside at the park and just instantly get scared. They see a cloud in the sky, automatically tornado watch in their brain, right?
Wow, good one.
Very sad or withdrawn for more than 2 weeks. Someone could be dealing with something, maybe a loss in their family, and it might be a very emotional experience for them for like a week or two. But if it persists for longer than 2 weeks, it could indicate a mental health issue. Another symptom is out of control risk-taking behaviors. Many people think that if you're suicidal or if you have a mental illness, instantly it's a rope around your neck or a gun to your head. Sometimes it's not that. Sometimes it's the subtlest of things, like not washing your hands, hoping that you're gonna get sick and die, or going around and walking across the street without looking both ways, hoping that maybe you'll get hit by a car. It's the simplest subtle details that some people don't even realize, but it's over time these symptoms really come out and show. Another sign or symptom is a sudden overwhelming fear for no reason and trying to harm or kill oneself or making plans to do so. Many people think that like self-harm is mainly just the wrist, but it actually can be wrist, thighs, stomach, anywhere there's skin, there can be self-harm. And I guess that's what makes kids hide it so well from their parents, because they don't want their parents to know. They don't want to be that one daughter or that one son, the cutting kid in class the one depressed teen. They don't want to be that, so they find ways to hide it. So those are just a few facts and symptoms and etc. about teenage mental health. Thank you.
The lack of support from the government here in Louisiana is something that we definitely need, because we definitely need the resources. There's a lot of our kids out there that need these resources that can't get them. There's a lot of parents out there that doesn't know where to go for their kids to get these resources. And one of the problems, especially in our public school systems, it's very huge. You know, a lot of kids have certain issues but don't know how to get them addressed, and teachers don't know how to handle those issues because they don't know what's wrong with them. And so that's one of the things I think we definitely need to be able to address or have training for. Another thing is, you know, but dealing with our police. You know, they need to be trained on how to handle certain issues or certain kids, because they can't reach out or don't know that this particular kid may have a mental issue and just obviously take him to jail or beat him down or whatever it may be. And not saying that it's always the case, but it could be a mental issue. So they need training on this also. So I think it's an apparent need for all of these resources. But I think one of the biggest issues is that a lot of us think that it's a white problem, especially in the black community. A lot of us think that it's a political problem, but it's an issue for all of us. You know, and especially in the black community, we always feel you know, hey, we've been down so far that, hey, you know, we can't have problems, or we're not supposed to have problems, or we're not supposed to have mental issues, or we're not supposed to have depression. You know, get over it, as one gentleman just said. You know, there's nothing wrong with actually going to talk to her. We don't think that we're supposed to go and seek help to talk to someone about our problems. But there's nothing wrong with going and seek out counseling. There's nothing wrong with going and seek out a pastor or a psychiatrist to go talk about what your problems are, because that's help. You know, every family member can't help you, but other people can. And that's some of the things that we need to know in our culture, to go out and start seeking this help. But that help needs to be available to us. So to my Democrats, to my Republicans, to the political higher ups, you know, let's get this done here in Louisiana, because it's definitely a situation and an issue that needs to be addressed. Thank you very much.
Change is necessary. In 2016, I wrote a book called The Fight Worth Finishing. It's all about my personal experiences with depression and suicide. I wrote this book to help others, but within my book also lies some serious truth about the mental health care system. I have been in the mental health care system in Louisiana, both in my hometown of New Orleans and also 2 hours away from home after a suicide attempt. And I was sent 2 hours away from home because, as you know, mental health funding has been cut, and every bed in the city of New Orleans had filled up too quickly. When I told the hospital in New Orleans that was transferring me that I did not want to go that far away, that I even had a psychiatrist that I can go and speak to, they told me I had no choice. They said if I did not cooperate with them, I would be restrained. I had no choice, and I had no voice. I was treated like a criminal. Mental illness is not a crime. We are people, and we breathe the same air as everyone else. Another reason I wrote my book is because I wanted to humanize mental illness. I wanted others to realize while depression and suicide are real, so am I. I am a human being with feelings, aspirations, and dreams. I am not that much different than everyone else. My battles with depression and suicide have never made me weak. I am stronger because of it. But some of the things I had to endure in the mental health system, I wish I never would have. I get frustrated when I turn on the TV, and the only thing I see about mental health is when someone has already ended their life, when it is being criminalized, or when we talk about the post-traumatic stress of Hurricane Katrina just once a year. I remember when I talked to a reporter in New Orleans, and I asked him, why is it that mental illness is always being so demonized in the media? And he said to me that they can only report on what was given to them. He said if we were to talk more about suicide awareness, it would only make more people want to attempt suicide. And I thought to myself, well, suicide is already the 10th leading cause of death in the United States. Without more awareness, we will continually lose people both mentally and physically to the system. The reason I became a mental health advocate, self-help book author, and life coach for those who go through depression, anxiety, and suicidal thoughts is because I am so very passionate about this cause. We need more heartfelt work and funding for the mental health care system. Laws need to be changed, and so does the state of how we treat others within the mental health care system. Wake up, Louisiana. Change is necessary. Thank you.
The media sometimes guides the conversations about post-traumatic stress disorder being a condition that only combat veterans suffer from, but the truth is, any one of us can be diagnosed with PTSD. Here in Louisiana, there are over 330,000 veterans that live among us and continue to give back to our communities. Across the nation, less than 1% of us choose to wear that uniform and defend the freedoms that we all enjoy, and we need to do better for them. Because some of us have suffered in silence for years regarding the harrowing images that we've seen in war or during our time in service to our country. And we all deserve the support and easier access to mental health treatment. Because we now know that over 20% of us that served in Iraq, or the veterans that served in Iraq and Afghanistan, suffer from some type of major depression or post-traumatic stress disorder. And more I hear my brothers and sisters in arms come to me and say that sometimes it is the personal embarrassment of having to admit that you have a mental disability, the long wait times of having to get someone to see you and hear you when you are in pain, the shame of needing to seek treatment or fear of being associated as being weak, the lack of understanding about the treatment options that are available to us, and the logistical problems, sometimes long travel times that are consistent with our care. So I'm going to say something to you because you guys have been such a great audience, and I want to share something with you, and I know that in this audience nobody's going to flinch when I say this. And so I want you to take a good look at me. I am a veteran and I have PTSD. And the reason I wanted to say that is because people have these images about what everybody looks like. And sometimes when I meet somebody new and I'm sharing something that makes me feel so vulnerable because this one horrible thing shattered my soul one day, that I am still processing and living through that, and people go, she's a vet with PTSD. Yes, I am. Look at me. There's nothing different from me than anybody else that needs help, and we all need to continue to support one another in this fight. And I want you to know that we need to continue to do whatever is necessary, thanks to great advocates like you, to get the funding allocated for veterans' mental health care needs so that they can be increased and that we can take care of the men and women who took care of us. Thank you so much for your time.
I want to start with saying that my journey started when I was 12 years old. I have suffered from depression since I was 12, but I was not diagnosed until my early 30s with clinical depression. Little did I know that through my journey of struggling with my own depression would bring me to March 2nd, 2015, when my daughter showed up at my office, called me on my cell phone and asked me to step outside for a minute. When I went outside, I could tell that she had been crying because her face was stained with tears. Her eyes were red and swollen, and I asked her, "Jamie, what is wrong?" And she wouldn't answer me. And then I said, "Jamie, what is wrong?" And I stomped my foot. And she says, "Mom, it's not good." And there's no easy way to tell you this, but Bobby's dead. My son was dead. His death caused by suicide, hanging himself in his closet. Little did I know that he was suffering with depression. I did not know he lived in Oklahoma. I lived here. It's the most heart-wrenching thing to bury one of your children over something that could have been treated had he not been afraid of what people would have thought of him as a father and as a provider and as a son and a brother. He didn't have life insurance, so we had to cremate him. Another thing that was really rough for me, because I felt like I was giving somebody permission to set my baby on fire and burn him down to ash and bone. And I'm sorry, I have to disagree with some. Stigma is a problem. People are afraid to admit they have a problem. I was afraid. They're scared. They're going to be labeled. They're going to be losers. They sleep too much. They're lazy. They don't interact with family. They're unsociable. It's not that. It's not that. Do you think we want to wake up in the morning feeling the way we feel?
All right, say that.
It's just like cancer, diabetes, heart disease. It's a disease. It's an illness that can be treated just like all the rest of them can. And why should we feel ashamed to stand up and say, something's wrong with me? I'm sorry.
Okay. Good.
It's only been a couple of years since I lost my son. It's still very raw. Think about him every day. But I decided I could either curl up in a ball and die myself, because believe me, I wanted to die. I wanted to go and be with my son. Or I could do something to honor his life. So I am a mental health awareness and suicide prevention advocate. And I will talk and talk and talk until I'm blue in the face. And if it only saves just one person, then I've done my job. So in closing, I just ask y'all to please pay attention to your family, pay attention to your friends. If they say they don't feel right, they're depressed, even if they make the remark, I just want to kill myself, take it seriously. It may sound like a joke to you, but to him it's not, or to her it's not. And I thank you for having me here and listening to my emotional rambling. Thank you.
I want to tell Mr. Tatum's story, as it touches and resonates with so much that's been said already. Mr. Tatum is our peer support specialist. He was incarcerated in Angola State Penitentiary for 28 years. During incarceration, he suffered an injury post a fight, and he is wheelchair bound. Mr. Tatum has every challenge and reason in the world not to be the awesome peer support specialist he is for us. With his guidance and with our desire to address the post-incarceration syndrome that should be recognized as major depression disorder, bipolar disorder, as all of the mental health disorders, we have embarked on addressing what happens to individuals post-incarceration. We expect them to come out and get a job, go find a house, snap to it, where it is impossible. Can I see a show of hands of anyone here who's been incarcerated or knows someone who's incarcerated or has had any dealings with the criminal justice system? Quite a number. It affects the community as a whole. When we have a physical illness, which I was a cancer nurse for about 18 years, so no one ever expected anyone with a diagnosis of cancer to snap out of it and get going. We didn't incarcerate or shield them away. Yet that's what happens with individuals who are suffering with a mental illness. We all have mental health. It is the disruption or the illness that causes the problem. Jail is not treatment. It is not a place for us to exist psychiatric care. In New Orleans right now, we are fighting against building 89 beds for treatment of mentally ill clients when we have a hospital sitting empty since Katrina that could be used for psychiatric care. I'm so glad to hear from the legislation and from the individuals that the paradigm shift is coming. It can't come quick enough. Remember, we are all touched by individuals exiting the criminal justice system, trying to get their life back, whether it's a relative or not. So I'm so glad to see the support and help here, and I know now that our fight is not alone and not fragmented in New Orleans or Lafayette, New Orleans. We're in this together. Thank you so much.
Helpless, hopeless, burnout, in a hole, and unable to rescue oneself. Have you ever been in a situation where all hope was lost? No one knew the depth of your pain. Your inward taunts, fears, and screams were heard by no one. I know the pain all too well. While attempting to complete my professional degree, long hours and frustration took a toll on my life. I found myself in utter exhaustion. Being from a community where it was taboo to speak about depression, I suffered in silence. There were days when I literally could not get out of bed. There were days when I couldn't explain it to my mom because being as a devout Christian as we were, it was read off, you need to pray more. Yes. You need to read more. You're not close with God. Something's wrong with you. So how do you have not a family member to trust? Who do you talk to? While in dental school, my grades started slipping. And whether you're in dental school or whether you're in college, they can care less if you are hurt. They care about your grades. If your grades slip, you gotta go. So for me, with all my depression and not being able to talk to friends and families, I became labeled as antisocial. For me, I had to literally leave dental school. It was my dream, my passion. My grandmother's passion for me was to be a doctor. I had failed my family. And that was the worst thing for me because being from a family that we were never in the shadow. We always lived a certain life. They taught us from young, we had to be a certain etiquette. You knew which fork to use. How do you do this? So how could I explain to my family that I had anxiety attacks? So I had to come home, no degree, student loans, and now I had to figure out what's going on. So 10 years later, finally, I was able to get the help I need. I had one doctor here in Louisiana that actually sat down and heard me, and I thank God for physicians every day. He asked me one question that changed my life. He said, "Do you sleep at night?" And I pondered the question. No, I wake up in panic. And he just looked at me, he was like, "You have panic attacks." And the first thing I replied was, "Black people don't have panic attacks. I'm sorry, that's not me. I'm sorry." So he told me I had panic attacks. And through medication and therapy, I was happy that I was able to get therapy. A lot of people can't afford it because most of your therapists, you have to pay out of pocket. And so I was blessed to be able to have a therapist that really helped me. I think about it every day. Countless people suffer a life of depression because there's a stigma attached to mental health. Enduring mental health disorders does not make them weak, lazy, or dangerous. They are creative, working, and productive members of society. I challenge each of you to look past their mask and really see them. The support and understanding of family and friends are critical to seeking help for one individual. You are a beacon of hope in the midst of chaos. Remember, we are all united in the tapestry of our Creator. Legislators, senators, family, and friends, let's work together to dispel mislabeling concerning mental health, and let's bridge a bridge of hope for our communities. Thank you.
Woo! How many of you believe in access for all?
Yay!
Access for all. I'm going to talk to you today about budget cuts. Okay? Their cuts are to the Department of Health and Hospitals and the Department of Education, when the cuts should be across the board. Okay? They're cutting us, our services, cutting us. Pretty soon we won't have any services at all. They're cutting education and the Department of health and hospitals when they should cut across the board so we won't suffer so much. Okay? This is very, very important. Very important. Every time we suffer budget cuts, we don't have any beds. They're building more jails, more in the Department of Corrections. They're not serving us, okay? We're not being served. We're being incarcerated with no services at all for people who need them within the Department of Corrections. They're being denied their mental health services. They're being mistreated while they're incarcerated. They're being denied their rights while they're incarcerated. And I know all of us know people who are incarcerated and being denied their rights to mental health services. We are suffering. And there are more suicides because they're not getting access to mental health services. The crime rates are up because people are being denied their rights to mental health services. I've been an advocate for 30 years. I've been a family advocate for 30 years. Parents don't know where to go or who to turn to. Kids are being kicked out of schools. They don't know where to go or who to turn to. Okay? So we need to stand up for our rights. If we don't know who to go or where to turn to, we need more family advocates. We need more people trained. We have peer supports, but we need family support. Family support. My son is here. He's 34 years old. 30 years ago, when he was 4 years old, I became an advocate for myself and others, teaching other parents what I learned. We need to turn things around.
All right. Woo! Right, yes.
He's a college grad. We didn't start out that way, but this is the outcome. He's a college grad.
All right. Woo! Good.
Okay? Our children can succeed. There is hope. There is hope. We can change things. We can turn things around.
We can. Yes, we can.
Yes, we can.
Yes.
Hey, everybody. It's good to be here. Thank you all for coming out for this important meeting. I wanted to start off thanking Vicki Ryan and Mental Health America for organizing the rally, and also in recognition of Mental Health Month, which of course we got rained out last month, but we're still here. Although we were delayed by the weather, I really appreciate her rescheduling this, and it shows her dedication and Mental Health America's dedication to make sure that people are aware of the ongoing needs of individuals and families that struggle with a mental illness. I wanted to recognize the important work done by other folks that have already spoken today, as well as those that will be coming, and I want to thank them personally for their work. It's an honor to be asked to speak before you today, and Ms. Ryan had asked me to make my comments focused on the issue of stigma and how it impacts people who need treatment and why they don't get the treatment that they need. So I wanted to keep it really simple because I don't have a whole lot of time, and so I did a trick that I've seen other speakers do, and that is I went to the dictionary. And so let's start off really simply as what is stigma? And stigma is defined as a mark of disgrace or infamy, a stain or reproach, as on one's reputation. So given this definition, you can see that there's an implication that if stigma exists, that it acts internally to prevent someone with a mental illness from getting the service that they need. In other words, it basically says it's their own concern about their reputation that acts as a barrier to treatment. And most people will say it's true. In fact, this section that I'm speaking in right now is about destigmatizing mental illness. So understanding this, as you all have heard of SAMHSA, the federal government that that funds mental health and addictive services has spent millions on anti-stigma campaigns to help individuals overcome stigma as a barrier. And many of the dollars have been spent on the campaigns I really believe have helped a lot, because I think that stigma actually right now is not the most important thing. And if you look now in 2017, it's time to stop blaming stigma as the major barrier and accept that when it's actually studied, what we find is that stigma is not a major barrier for why people don't get mental health treatment. In fact, SAMHSA itself did a study, and they said that stigma, when you weighed all the different reasons why people don't get the help that they need, stigma was number 8. So I'm going to go ahead and tell you what the ones 1 through 7 are, and just see if you understand that and believe in it too. Number 1 is people felt that they couldn't afford it, so they didn't go after getting the help they needed. 2 was that they believed that the problem could be handled without going and getting help for it. And I think all of us have some level of denial with whatever type of challenge we have in life. Number 3 was that people didn't know where to go get the service, even though they were ready to go get it, and even if it existed. People said the time to get the care, they didn't have the time in their busy schedule. Some people didn't feel like treatment worked, and they didn't feel it was worth it. And then some people felt that they really didn't need treatment. Number 7 was that health insurance didn't cover enough treatment that they needed. And 8 and 9 really is where stigma fell. It said access might cast a negative light on themselves, or that they didn't want other people to find out that they had a need to get mental health treatment. And so when we talk about stigma as being a major problem, it is still there, but we've got to think about it. If somebody gets over the whole idea of admitting that they need to go get help, what if they go to get the help and the help doesn't exist? And that's really what I think is really so important, is that we can talk all we want about don't be afraid to come in, but when it comes down to it, does the treatment that people need really exist? And is it going to exist as we go forward? One of the things that we really have to start putting our efforts on is what the research is telling us, and that is that it's not stigma that's preventing people from getting the help they need, but it's really that people with mental illness are discriminated against by health care funders. This includes federal programs such as Medicaid, which is the largest payer of mental health treatments, and the private health insurers. In fact, if you look into it, Medicaid actually provides mental health services as an option. States that participated in Medicaid expansion recently through the Affordable Care Act are seeing larger numbers of people coming in to get the care that they've needed for so long. Before Louisiana did the expansion, I spoke to several providers in other states that had it, and they saw an increase in the numbers of people coming to get care by 30%, which tells you there's a lot of people out there that are really struggling to get through each day, and it's not the stigma. It's about whether they can afford it, whether it exists, whether it's funded, whether what they need is there. Prior to expansion, many people suffered in silence, not living full lives and struggling to make it through each day. And I was just so pleased, and I know all of you are too, that Louisiana did move to expansion this past July. So now for almost a year, we've had Medicaid expansion. More people are coming in. Even with the parity laws that passed back in 2008, almost 8 years ago, the Affordable Care Act, the number of services, and the duration of paid services for mental health treatment is still capped. Nowhere do you find this limitation placed on people with hypertension, diabetes, heart disease, or any other physical illness. In the most recent statistics published by NAMI here in Louisiana, 23,000 youth and 406,000 adults didn't get the mental health treatment that they needed last year. Louisiana is ranked 41st out of 50 states. And so we can only continue to really pray and work hard to make sure that Medicaid expansion and our services continue to be available for so many that need them. So what I want to do is, in closing, is say, let us not hide behind the concept of stigma, but address the real danger of discrimination towards people with brain diseases, and ensure that both governmental and private providers, private payers, Do not ration or arbitrarily set caps on treatment. We must provide access to evidence-based practices that save lives, hold families together, keep employees at their jobs, and keep students in school. We need to continue to hold the gains on treatment access that we've started in Louisiana through the Medicaid expansion, and we need to push to ensure that parity laws are enforced. Thank you.
I want to talk to you about some of the work that we're doing and some of the work that we need your support to make successful. One thing that I've heard a lot about today and that we discuss a lot at the department and are putting resources behind is the decriminalization of mental health. We are the #1, and possibly #2 next to Oklahoma, but #1 incarceration state in the country. And our country is the highest has the highest incarceration rate in the world, which means Louisiana incarcerates more people than anywhere else in the world. And we won't stand for that at the health department. We know that many people are in jail because of mental health issues that went unaddressed or substance use disorder issues that went unaddressed. And we want to ensure that once those individuals come out of jail, they have an opportunity to seek the health care that they deserve. And so we have so far enrolled over 700 ex-offenders and folks that are coming back out into our communities, over 100 of them diagnosed with significant health needs, including mental health, and ensuring through our human service districts and through our private providers that they have access to mental health treatment, which will hopefully keep them out of jail and help them realize their potential throughout our state. We also have, through our human service districts, a lot of good work going on with our local law enforcement agencies. Crisis intervention treatment is something that we train law enforcement officers on so that they recognize what is mental health and what is not criminal behavior. And so we are keeping people out of prison that do not belong there who actually need our support and need access to treatment. The other major issue that we are working on in the department is our opioid epidemic. We have more prescriptions for opioids in Louisiana than we do people. The governor and the secretary will not stand for this. And we have done several things already. We have a lot more in place. Prescription limits through our Medicaid program, access to medication-assisted treatment and naloxone to save lives. We want to see our opioid-related deaths decrease substantially within this governor's term. We've received over $22 million in federal funds to combat the opioid epidemic. We know from spending these last several weeks at the Capitol that we can't only depend on state general fund to address this issue. So we are working tirelessly to ensure that Louisiana has the funds it needs to address the epidemic. In closing, I want to draw special attention to an issue that has become very close to my heart and one that has really caused a lot of us at the health department to address with a sense of urgency that maybe we hadn't before, and that is youth that are suffering with developmental disabilities, behavioral health issues, mental health issues, and trauma. We don't have the service network that we need to serve these youth. Our Department of Child and Family Services, our Office of Juvenile Justice, and the Health Department have taken significant cuts over the last 8 years. And we have had to close resources and end resources that help these youth be successful in their lives and stay in their homes with their families. And so I want to assure you that through a trauma-informed care approach, which our Office of Public Health is training providers on, and the one that which we will do our work every day, that we want to make sure that youth come first. And we've managed to save in our budget reduction some significant services for youth that stood to be cut. We want to preserve those and work with families and communities to make sure that youth, above all, get what they need. Amen. Thank you again so much for your advocacy, and you can continue to count on us to stand by your side. Thank you so much, and have a good rest of your day.
I wanted to stop by for a minute before I made my next stop to ask you, please, don't stop fighting. Don't stop coming. Don't stop asking. We have so many who don't have a voice, who have asked us to serve. Not just those who get all of the money, not just those who are going to receive full funding of TOPS, We have a need in our community to address this. I'm proud of the fact that on the floor of the Senate on Monday, although in the House's version there were no dollars for mental health, that we added another $3 million to that budget.
Hallelujah.
But I gotta tell you, it went back to the House because they didn't concur with that.
What?
So it'll end up in committee. So the fight continues. And that's why it's so important that you're here today.
Right.
Call the family, call the friends. You have all of our numbers. Send emails. Please don't stop. We can never get tired. Our last speaker stopped on yes we can and yes we will. Yes, we must continue to fight for those of our family members, our friends, and those in our community who are in need. Let the governor know how important this is. He's on board, but we have 105 members in the House and 39 in the Senate. We gotta help them. We gotta help them. We can't let them forget that the voices that they don't hear are voices in need. And when we speak for those who ask us to come here and represent everyone. Everyone. When the money goes out, it can't just be to a select few. We can't continue to close our institutions. We can't continue to stop access. We have to provide that access.
Amen.
And we're not looking for a handout. We're not looking for anything free. We just need that bridge so that we can cross over. And we're all in it. So I want to thank you for being here today.
Thank you, brother.
And I want to ask you, please don't give up. Don't get tired. Continue. Hope is alive in each and every one of us. I'm going to continue to fight. Let's keep all of us in prayer. Even those who don't understand, we're going to pray for them that one day that blessing will come down on them. God bless each and every one of you. Thank you for being here today, and we're here for you. God bless.
I want to thank y'all. God bless y'all. I hear you, and the Senate hears you, and the House hears you loud and clear. We will be your voice. We will make sure to continue to fight for your funding. We will make sure that when there's prescription medication needs, that not only you get it, but there's the right resources so you take it on a regular basis. I'm a pharmacist also, so everything you've been saying, I firmly agree with you. And let me just tell you once again, we hear you loud and clear. I will make sure to do everything I can to provide you the voice that you need, not only for your issues as far as accessibility, as far as prescription medication, as far as funding, but I am proud to represent you and represent your thoughts of view. And from sitting in a drugstore every day for 20 years, every day, I can't tell you I know the shoes that you walk in, you and your families, but I can feel what you're doing, and I'll be right alongside of you. And realize that when you're elected here, we maybe pass some laws, and hopefully we pass good laws, but when we go home and you call our offices, we need to be your voice. So if you need us, you call us, because there's day-to-day challenges that you and your family and your loved ones have to fight. So we're here to fight with you. I want to say God bless you. Enjoy your day. It's your day, and keep the fight. Thank you very much. God bless y'all.
I am excited to be here just to say, first of all, that your work has not been in vain. Your advocacy has not been in vain. Now, we still have a long ways to go, but let me tell you, we have made a lot of steps and a lot of strides. And as I looked through the number of bills that have been filed, I see the increase of the attention being given to the mental health community, which is something that really didn't happen before. People didn't want to talk about mental health. That was like a taboo subject matter. But that whole conversation is beginning to change. And the word that came to me was paradigm shift. We are in the midst of a paradigm shift. Yes. What used to be a drought is now getting ready to turn into an oasis.
Yes, yes.
Not just in the state of Louisiana, but across this country, because the attention to this issue has begun to change. And so I want to say to you, the reason why that is happening is because of your advocacy. The importance of staying the course, the importance of not giving up, the importance of being there and being the voice. As a result of that, we are now beginning to see many effective changes. One of my colleagues has actually put forth a task force to really begin to study all of the components to make sure that there's connectivity and not disconnect. You just heard from the Deputy Secretary. I have the opportunity to serve on health and welfare. Somebody said, some people call it warfare.
Yes, yes.
And finance. So I get to hear about the healthcare issues, and then I get a chance to hear about the money. Yes. And we have asked DHH or LDH. I told them the other day, I said, I know they've asked you to walk on water and to turn water into wine. And only God can do that. But they have given the attention to the issue and they've made it a priority. And I have to say, I thank our governor as well, because he is a man that cares about people and about the things that concern people. And so he has chose people that are in his cabinet who also care about people. And that's the most important thing, because people are not just numbers. And at the end of the day, that's the one thing we can never forget. So I just want to stop by and say hello and tell you to continue the good work, because we've come a long ways, but we have a long way to go.
We do.
And you do have people that care about mental health, and because you have continued to keep making that temperature higher and higher, it's made the conversation go up and up. Amen. Again, thank you so much for being here, and God bless you.
If you'd like more information, we are all over the place. We are on Twitter, Mental Health America of Louisiana, or MHA. You can find us on Facebook. We even have a website, and so we're not hard to find. You can contact us, and we're also NIMH partners. NIMH stands for National Institute of Mental Health, which is huge. That means any subject that you are interested in learning about with behavioral health, whether it's stress, anxiety, OPD, PTSD, postpartum, any subject there is, you can contact us. We'll be more than happy to come over and do a training, a presentation, and also provide you with brochures.